हाय एवरीवन, वेलकम बैक टू अनदर वीडियो। एंड आज हम पढ़ेंगे एक चीज़, मेडिसिन प्रेप मैनुअल फॉर अंडर ग्रेजुएट 7th एडिशन। ओके, सो ब्लड के रिलेटेड जो डिजीज़ या फिर डिजॉर्डर होता है वो आज जनरली हम पढ़ेंगे। ठीक है, मतलब डिजीज़ ऑफ ब्लड के ऊपर। ठीक है, तो देखते हैं, थोड़ा रीडिंग मार लेते हैं। सो क्वेश्चन होता है, गिव ए ब्रीफ अकाउंट ऑफ एरिथ्रोपोइटिन, दैट इज एरिथ्रोपोइटिन को ईपीओ कहा जाता है, एरिथ्रोपोइटिन। ठीक है, ईपीओ। रिकॉम्बिनेंट ह्यूमन एरिथ्रोपोइटिन, दैट इज स्मॉल आर, उसके बाद एच यू ईपीओ। ठीक है, एंड डार्बी पोएटिन अल्फा। So give a brief account of erythropoietin, recombinant human erythropoietin, that is RHUEPO, and darbepoetin. Okay. So what are the ectopic source of erythropoietin? Now erythropoietin is a glycoprotein having a molecular weight of 36,000 Dalton. It is primarily produced by the juxta-tubular interstitial cells of the renal cortex. In the fetus, liver is the primary site of the production of erythropoietin. In fetus, liver is the primary site of production of erythropoietin. Hypoxia is most potent stimulus for erythropoietin production. Kidney respond to hypoxia by increased production of EPO. Another important stimulant is the presence of anemia. Erythropoietin stimulates erythropoiesis by acting on erythropoietic stem cells, stimulating their increased proliferation. Flowchart 1.1. It may also protect the neuronal cell from the noxious stimuli. Ectopic sources of erythropoietin are given in table 1.1. Recombinant human erythropoietin. So it has the same biological effect as endogenous erythropoietin, available as erythropoietin alpha and erythropoietin beta. Indication for use of recombinant erythropoietin are given in box 1.1. Not recommended in patient with heart failure having anemia. एडवर्स इफेक्ट क्या होगा? हाइपरटेंशन, ब्लीडिंग, इंक्रीज्ड रिस्क ऑफ थ्रोम्बोसिस, हेडेक, आर्थ्राल्जिया, कॉफ, नोजिया, इडिमा, डायरिया, hypertension, venous thromboembolism, and progression of cancer. It can cause pure red cell aplasia in patient with chronic kidney disease. Then darbepoetin alpha, an erythropoiesis stimulating protein similar to the erythropoietin produced in Chinese hamster ovary cell by recombinant DNA technology. तो हाइपोक्सिया, किडनी, उसके बाद एरिथ्रोपोइटिन, देन उसके बाद एरिथ्रोपोइसिस इन होगा, उसके बाद हेमोग्लोबिन इंक्रीज होगा, देन रिडक्शन in hypoxia. Okay, so erythropoietin production and its action. Now ectopic sources of EPO, that is polycystic kidney, cerebellar hemangioblastom, uterine fibroma, renal carcinoma, उसके बाद हेपाटोमा, उसके बाद फियोक्रोमोसाइटोमा. ठीक है, नाउ कमिंग टू द बॉक्स 1.1. इंडिकेशन ऑफ recombinant human erythropoietin. Treatment of anemia associated with chronic kidney disease. Patient with normal or low iron store needs concomitant administration of iron to achieve an optimal erythropoietic response. Target is to maintain hemoglobin around 11 से लेकर के 11.5 ग्राम पर डेसीलीटर. केमोथेरेपी इंड्यूस्ड एनीमिया हेमोग्लोबिन लेवल आपका लेस दैन 10 ग्राम पर डेसीलीटर इन पेशेंट विथ कैंसर व्हेन इंटेंट ऑफ chemotherapy is non-curative. Treatment of zidovudine induced anemia in HIV patient. Treatment of anemic patient, hemoglobin value less greater than 10 to less than equal to 13 gram per deciliter who are at high risk of perioperative blood loss from elective non-cardiac non-vascular surgery so as to reduce the need for allogenic blood transfusion. Patient of myelodysplastic syndrome with anemia having low risk, that is low transfusion burden and low endogenous serum erythropoietin level. उसके बाद हाफ लाइफ अप्रोक्सीमेटली 3 टाइम दैट ऑफ recombinant human erythropoietin and hence needs to be given less frequently. Side effect profile and therapeutic value similar to I think recombinant. Okay. Recombinant human erythropoietin. Not approved for zidovudine induced anemia or for perioperative blood loss. ठीक है ना. ये कहाँ तक गया है. नाउ क्वेश्चन हो गया डिस्कस ब्रीफली अबाउट हेमाटोपोएटिक ग्रोथ फैक्टर दैट इज HGF. So hematopoietic growth factor act at different stages of hematopoietic cell differentiation. Some hematopoietic growth factors such as interleukin 1, interleukin 3, interleukin 6 exert their primary effect early in stem cell differentiation and are therefore important for the differentiation of multiple blood lineage. Others such as epiogranulocyte colony stimulating factor that is GCSF, granulocyte macrophage colony stimulating factor and thrombopoietin that is TPO, thrombopoietin exert their effect later in the differentiation cascade and their effect are more lineage specific. Their recombinant form are available for therapeutic use. उसके बाद एरिथ्रोपोइटिन डिस्कस अबव जो कि हमने अभी अभी पढ़ा था एरिथ्रोपोइटिन के बारे में. नाउ ग्रैन्युलोसाइट कॉलोनी स्टिमुलेटिंग फैक्टर promote survival, stimulate proliferation of a neutrophil progenitor and promotes their differentiation into mature neutrophils. In addition, it causes premature release of neutrophils from the bone marrow and enhance their phagocytic function. Normally, it is produced by the endothelial cell that is fibroblast and macrophages. Also available as pegylated GCSF which has longer duration of action. Indication of a GCSF are given in table 1.2. Now indication for use of a GCSF. Primary prophylaxis to reduce chance of a febrile neutropenia following chemotherapy for solid tumor and non-myeloid malignancies. Okay. So इसमें comments क्या है. It risk of a febrile neutropenia is high greater than 20%. as determined by disease characteristics and myelotoxicity of a drug used, or if risk of a febrile neutropenia is intermediate, that is 10 से लेकर के 20%, age greater than 65 years, presence of a coexisting illness including COVID-19 and poor performance status. उसके बाद प्राइमरी प्रोफाइलेक्सिस आफ्टर ऑटोलोगस स्टेम सेल ट्रांसप्लांटेशन फॉर नॉन माइलॉइड malignancy following myelo ablative chemotherapy. So may be administered after allogenic stem cell transplantation, although there may be increased risk of a severe graft versus host disease and transplantation related death. उसके बाद फॉर मोबिलाइजिंग हेमाटोपोएटिक प्रोजेनिटर सेल इनटू द पेरिफेरल ब्लड फॉर पेरिफेरल स्टेम सेल ट्रांसप्लांटेशन, इसमें कुछ कमेंट नहीं है. नाउ सेकेंडरी प्रोफाइलेक्सिस इन पेशेंट विथ solid tumor and non-myeloid malignancies with a previous history of a febrile neutropenia. So ये कहाँ पर indicated only for those who require high dose chemotherapy and any dose reduction may compromise treatment outcome. Example, patients with estrogen receptor negative breast cancer or non-Hodgkin lymphoma. Now, may be administered in patient with febrile neutropenia who have high risk of infection related complication prolonged मतलब greater than 10 days and severe neutropenia that is less than 100 per microliter, hypotension, multi organ dysfunction or invasive fungal infection. So not routinely recommended in all patients with neutropenia with or without and fever. Radiation induced myelosuppression following nuclear or radiological incident, इसमें कुछ कमेंट नहीं है. Now GCSF granulocyte colony stimulating factor, granulocyte colony stimulating factor, okay, GCSF. So granulocyte colony stimulating factor is given in a dose of 5 microgram per kg daily as a subcutaneous injection. उसके बाद pegylated GCSF is given as a one-time dose of 6 mg subcutaneously for each cycle of chemotherapy. Adverse effect, fever and bone and joint pain. Secondary myeloid tumor can occur in some patient as a late adverse effect. Then granulocyte macrophage colony stimulating factor. It causes an increase in neutrophil, eosinophil, macrophage and sometimes lymphocyte count, usually administered as a daily subcutaneous injection of 250 microgram per meter square. Both GCSF, granulocyte colony stimulating factor, and granulocyte macrophage colony stimulating factor appear to have similar efficacy in the indication given above. Thrombopoietin, it is the most potent cytokine promoting proliferation and maturation of megakaryocytes. It also primes the platelets to aggregate in response to sub-threshold level of thrombin, collagen and adenosine diphosphate, that is ADP, normally produced by liver, skeletal muscle and kidney. In cancer patient receiving chemotherapy, it has been shown to reduce the duration of post-chemotherapy thrombocytopenia, though there is no increase in survival. However, many patients produce antibodies against TPO, and these antibodies also cross react with and neutralize endogenous TPO to produce a paradoxical thrombocytopenia. Indication of a TPO are given in table 1.3. Adverse effect क्या हो जाएगा? Adverse effect include headache, dizziness. ये बार बार क्यों बंद हो जाता है? Adverse effect include headache, dizziness, muscle ache, nausea, rarely serious effect such as vascular occlusion, producing myocardial infarction, stroke, portal vein thrombosis. TPO mimetics should be avoided in patient with thrombocytopenia associated with myelodysplastic syndrome, that is MDS, as they may increase the risk of progression to acute myeloid leukemia. सो आज के लिए इतना ही, मिलते हैं अगले एक इंटरेस्टिंग वीडियो के साथ. तब तक के लिए जय हिंद, वंदे मातरम. थैंक्स फॉर वॉचिंग.